looks to smooth the transition between health into community health and wellbeing support. So, just to give you a bit of an overview, Pennine Lancashire is one of Sport England's local delivery pilot areas, and that is testing and learning what it takes to create a population level shift to levels of physical activity. Pennine Lancashire consists of 6 districts, and the Lifestyle Hub looks to change the system across how health kind of interacts with community. And then the ambition later down the line is that we develop this model fully so that it becomes the front door to population health management within an integrated care system. So the challenge, we know that a lot of what keeps us healthy lies outside of the medical consultation room and within the communities that we actually reside. However, for a healthcare professional, trying to keep up-to-date knowledge of what service can be right for which patient can be a bit of a minefield. There's lots of different physical activity opportunities, healthy lifestyle services, there's social prescribing, and health coaches, the list goes on. The Lifestyle Hub is designed to remove that confusion. It has a single point of access where GPs can refer into using EMIS or a self-referral online form if they're not on the GP system or people want to self-refer. And this is then picked up by a hub advisor who, based on the information that they receive, have a person-centred conversation to understand more about the person's needs and a real discussion around what is available within their local area that they might want to interact with. They then connect the person with the right programme in their locality. The services that we currently work with range from working across with leisure trusts who offer both mainstream and supported physical activity opportunities like your cardiac and pulmonary rehab. You've got health trainers, health coaches who offer you one-to-one behaviour change support, smoking cessation, weight management, social prescribing who work with people on the wider determinants of health, and mental health and peer support services. And since the hub has developed, it's opened up really new and exciting pathways with specialist kind of areas. And one particular example is around the post-COVID syndrome service. And what we've done is we've managed to create a kind of a step down from the clinical model and working with those therapists into supported physical activity within the community with our leisure trust partners. But also, what the hub can do is it identifies gaps within the community as well. And what we've done is we've understood that actually across the East Lancashire region, we've identified that there is a real lack of peer support for people living with long COVID. And we've been able to feed that back into our clinical reference groups, get some funding and help to kind of bolster that gap within the community. So to close, this model has not reached full maturity yet. We're still working and ironing out some things, but we are on an exciting journey. Being part of the local delivery pilot really just gives us time and space to test out and see if actually it does cut down on confusion for GPs and healthcare professionals. If it actually removes confusion for the individual around what help and support is out there for them in their local community. Which in turn we hope will reduce dropouts or DNAs by focusing more resource on the beauty of that conversation. And finally, this is a chance to change that local system so more people are connected into physical activity and health and wellbeing opportunities. So I guess to close for me, I would like to use this opportunity and this platform today to ask you a question. I'm not a clinician, I'm not a GP. I guess if there's one question, would this model work for you? We're testing it, we're learning about from it, or help you. But also, as we start to really grow and develop this model, from your perspective, what is it that we need to consider, or what is it that we need to implement to make it really worthwhile? That's it. Thank you.